In the last episodes, we summarized the incidence of file breakage, which is our worst endodontic nightmares, as well as the impact that this can have on the outcome of our treatments. So, ladies and gentlemen, welcome to the third episode of Endocast, hosted by Ahmed Shawky. Hi, Ahmed.
Hi, Francesca. And of course, my beautiful host, Francesca Cerutti. So, as we were talking about the topic of the file breakage, file separation, so this episode aims to analyze the possible causes of failure of the instruments, I mean separation. And Francesca, we mentioned in the previous episode that the separation can occur as a result of two types of failures, torsional or cyclic stresses. Can we prevent or at least minimize the incidence of separation based on those two failure modes?
I think that we have to know that there are some factors that can increase torsional and cyclic fatigue, and some of them we can control, some of them we cannot. So we have to discriminate between what we can directly control and what we have to adapt to. So what do you think? Where are we starting from?
Yeah, I totally agree with you about that, because some factors we cannot change because they are there, and some factors we can adapt to. So let's start by the factors we cannot change or we cannot control. And if I understand you well, these factors, the clinician needs to adapt to them because, for example, he can't change the tooth. So am I right?
Yeah. We can try, but probably we are not going to solve the problem. So, yes, the tooth and the root canal anatomy, obviously, and also the patient, because sometimes we really have to adapt to the kind of patient that we have in order to succeed in our case. And I think that one of the things we can use to adapt to the anatomy of the tooth, for example, is our access cavity. In this case, I would have loved to do a caries-driven access cavity because there was this huge buccal cavity and I was seeing the pulp. But there was no way for me to have a straight line access to the root canal. And so I had to modify my access cavity, and I ended up with this. So with a conventional access cavity, even if I had a great access from the buccal side. And so, yeah, we have to just remember that we need a straight line access for our files to the root canal system. And so the access cavity is a tool that we can use in order to facilitate our work. What do you think about doing an access?
Yes, I'm going to go a little bit far from that because we know that we need to do an access that as small as practical, not as small as possible, because this is a very important topic, and we suffer a lot in our days with that, and it can be one of the most important reasons for breaking a file in the coronal part of the root canal system. So we need to take care about the access cavity and how to do it, because we want as much as convenience for our instruments, and I call it instrumentation convenience. Otherwise, the whole length of the file might break.
Yeah. Another factor we were saying before was the patient. Some patients have a limited mouth opening, and there's nothing we can do about it. I find it very useful to have these bite blocks that help the patient having a stability in its opening, and maybe help me getting a little wider opening from the patient. This is something that I really love to use in these cases. Otherwise, you have no access to the tooth, you don't see anything. If you're working with a microscope, you're so stressed, and that's a way to adapt to this clinical situation.
Yes, in this aspect, we need to also to highlight, and I'm sure you will agree with me about that. When you relax the patient, everything is good, but sometimes even with the bite blocks, you can also have a restriction. So this comes the value of using a multi-sitting files because they are pre-bendable files. So you can just take with your fingers like a manual file, pre-bend them, put them inside, and then attach the motor. So that's another thing we should know about how to adapt by selecting a file for the mouth opening.
And if you have the indication for a crown or an overlay, do you flatten cusps?
Yes, sometimes if the case is indicated, because of course the endodontist is one of the decision makers in the restorative treatment plan. So I guess when I have some restriction, I can reduce the height a little bit if the tooth is indicated for coverage, because this will make me gain a few millimeters to get into the cavity and to the root canals. That sometimes, whenever indicated, we can do it.
And give us an advice. How can we adapt to the root canal anatomy to prevent file breakage?
That's the most important part of the story, because this is one of the things that we cannot change. And let me first say that with root canal anatomy, variability is a rule. There is no patterns. You cannot follow a pattern for a lower molar in every case. No, sometimes you have different anatomy in each lower molar you can have. So the clinician must be flexible in the strategy he's proposing for the treatment or planning for the treatment. In other words, we need to address a proper technique for adapting to the anatomy, which is the step-down approach or the pound-down approach, and is the safest technique to adapt to the root canal anatomy. Then the coronal pre-flaring, which is the most important in that technique. So I can just widen or enlarge the coronal 5 millimeters, for example, of the root canal, so that I can glide into the deepest part of the root canal. And by this technique, we are adapting and addressing each part of the root canal system. We are not trying to change the anatomy, but we are adapting our strategy to the present anatomy. And this will end by going safely to the apical third.
Yeah, and also glide path. A reproducible glide path, in my opinion, is one of the major factors that help us preventing file separation. Because if I have a glide path, all of the following instruments are going to follow that path and work better, work safer. What do you think?
Yes, many cases, as in this case, I remember very well, the case was having a very small file in the coronal part. And when I see that pre-treatment image with the small file in the coronal part, this means that the strategy of shaping was not that sound. The clinician was unlucky to not be able to address that in the beginning of his treatment, so he broke size 15, maybe file. And when I want to correct that, I need to do what I just said. I need to pre-flare in order to remove the file, and then I do my glide path, which is a reproducible, smooth path from the coronal part of the root canal down till the apical end. This will make very severe curvature just an easy, a piece of cake curves for anyone, not the specialist, anyone. So since we're here, I would like to know your approach about creating a glide path in your cases. Mechanical, manual,
okay.
What's the approach?
Well, as you said, it has to be a smooth path. And you achieve this kind of smooth path with a small taper instrument. That is going to give us so many benefits because we are going to respect the root canal anatomy. We reduce the incidence of file separation, but also of transportation or straightening too much of the curvatures or going to remove too much dentine, because our files are going to stick to that path. And, I am a continuous rotation lover. So I love getting my glide path with rotary files. 95% of my cases, I do a full mechanical instrumentation because I learned from Fabio Gorni, and he taught me like this, so I'm going to stick to what my master said. But I find it very convenient because I save a lot of time, I reduce the risk of doing ledges, because K files are stiff. They are stainless steel, so they're going to straighten, they're going to maybe do some small ledge if I don't manage them properly. So it's going to give me a better result in a shorter time. Who am I to say no?
Exactly. I think this is true. Mechanical means better than manual means. So I think we have to, and we said that we have to know our instruments, design, metallurgy, everything, but also we have to watch our instruments.
Yes. Yes, carefully.
Yeah. I think that the clinician must check his instrument for signs of deformations like over twists or unwinded flutes, because this can give him an idea that this file is about to separate. And in this aspect, I'm going an example, a funny example, that the files speak when they are about to break. So we have to listen to them. We have to watch them. So unwinded flutes, abraded surface treatments, like the gold file becomes silver, the blue file becomes silver. We have to watch that. We also have to clean our flutes frequently, because if I have a clogged debris inside the flute space, this will make the file as a solid thing rotating inside the root canal. This will create a lot of torsional stresses, and eventually the file will break, even if no curvature existing. And thanks to the Stile Italiano Endodontics group, we have something to clean the files. We have the Ergo, and we can do it easily with the sponge, the cleaning sponge, without having to have a gauze or cotton that goes around the flutes. It can make it perfectly. Also, the clinician must stick to the manufacturer's recommendation about the settings of the file, especially for non-specialists, because some specialists can modify according to the anatomy. But when we are talking about a clinician, a general dental practitioner, we have to stick to the manufacturer recommendation and never push the file dry.
Yeah, and I would add, never push the file too much, because if you have to push, there's something wrong. So maybe you should take a step back and see again your glide path and try to understand why you have to push in that area, or maybe pre-flare a little more. So it happens to me several times. I pass one file, perfect, second perfect, third, no, there's something wrong. Let me take a step back and maybe pre-flare a little more, because I'm not wasting time. Because if I separate that file, I'm going to waste a lot more time trying to remove it. So I think it's a safer option to do so. And what about the cinematics again? Obviously, and I have to tell it every time, I love continuous rotation, but reciprocation is going to make the time to fracture of the file longer, because it's going to reduce all the stresses and the cyclic fatigue that we said before. But with reciprocation, you have to irrigate more frequently. And this is a fact.
Yes.
Because you don't want to create blocks with the debris inside of the root canal. And also, as you said before, we have to remember that we love them, but our rotary files are not our relatives. So when it's time, we have to discard them and say bye-bye and go for a new one. Because
we hate goodbyes, but not to the extent to break the file.
Yes. I think that it's something we can live with, even if it will be hard to separate from them. But better to separate it from a file than a separated file into the root canal. So yes, I think we should just pick correctly the time to discard a file. Some people say, I use a file for 5 root canals. I don't do this kind of reasoning because sometimes it happens to me to use a file once, and then you said, my friend, that's all you could do, and I change it. Above all, the first file, the small ones, because they do most of the job. What do you think about this? Do you do the same?
Yes, of course, and I'm totally agree with you. And we, in our courses and in our lectures in the university, we are hearing a very weird question about how many canals that the file can shape. So I think this is a question, and this question is not meant to be asked in the first place, because we are talking about something we cannot change the anatomy. So sometimes I take a file and put it inside the root canal, and I decide this file won't be used again. It's just a one use file, because like the case that we showed, each file that shaped that root canal was used once and then discarded. And to be frank, sometimes I use the same side of the file, 2 files in the same in the same tooth. So 2004 to shape it, and then I feel that it's bad, I discard it and I use another one. So in this way, we cannot just say that file can work 3 molars, 4 molars. No, sometimes we just use it once.
Yeah, definitely. But I heard you are preparing something special for the next episode because you are finding a guest.
Yeah, I think when we're talking about the management of separated instruments, we have to get someone who are really expert in that field. And it's not just an expert; he's just a delicate endodontist. So when he manage those files, he don't do a lot of damage to the tooth. So, but shall it be a surprise? Because
of course, now, we need to create some suspense for the next guest, who's royalty.
Exactly. Yeah.
Okay, so
we will ask him to be with us maybe 1 or 2 times, maybe.
Okay, if he can do us this gift, I will be more than happy to have him. So, guys, if you have questions, doubts, whatever, you drop us a line and we will get back to you. And stay tuned for the next episode of EndoCast.